sorry to meet you under these circumstances. I'm reading your whole chart. So, I understand that they found this accidentally, right? They were looking for your aneurysm and they said, oh, by the way, you have something of your liver.
Yeah, that's right.
Do you have any pain there?
No, I
You don't feel it? You're eating okay?
don't.
Losing weight?
No.
No? Good.
The only thing that I cannot eat too good is because of my teeth.
Oh, okay.
I'm planning to pull it out.
Oh, okay. All right, go ahead and lie down. Okay. Have you ever had surgery before in your life?
No,
None? Any cancer in the family?
none.
No? Okay, let me take a look at your...
Yeah. I thought, well, you know what? Because the first time that they check with the scan,
Yeah.
they push it too hard like here,
Oh.
and it hurts.
Yeah.
It really hurts when they push it too hard.
Right, I think it'll hurt anybody if they put too hard. Okay, well, the biopsy showed that unfortunately this is cancer, but there's different kind of cancers, in the liver, and this seems to be, like Dr. Oval said, neuroendocrine cancer, which means it's one of the slowest ones, and that's why we think you don't have any symptoms. And it's probably been there for 2 years or so.
Yeah,
or even longer. I mean, this is, and some people can live, not some, a lot of people can live their whole life with the but we still call it cancer because it'll grow. So there is no there's really no good chemotherapy for this. There's no radiation. The only way is to cut it out. But once in a while, this type of cancer can be fast. Okay, I've had the same type of neuroendocrine cancer patients that I saw was just limited, and then all of a sudden a year later, it's all over.
Yeah.
So that behaves like a real cancer. So there are neuroendocrine cancer that behaves like a typical fast cancer, but most of them are slow. We cannot predict which one this is. Only way to know is if you have a CAT scan 6 months apart, then you see, okay, 6 months later, how much did it grow? Then you can say if it's slow or medium or fast. I don't recommend waiting 6 months and seeing it. I recommend cutting it out in case.
No, doctor. Please wait for 6 months just in case. Or maybe.
Also, the second problem is I've had another patient just like this. We went in and it was too big to cut out. Because if it gets, it's very big right now. If we wait too big, I have a diagram, it will grow towards the stomach, or more importantly, it'll grow towards your diaphragm. The diaphragm, the muscle that separates to lung. Above the diaphragm is lung and heart. I've had situations grow to the diaphragm, got stuck, and you can't take out that. So that's what I fear, is that if it does grow, it'll grow to either the diaphragm above it, or the stomach to the left of it, or the pancreas below it. And we don't want that to happen. So that's why I recommend cutting it out.
No. No,
if it was small, we can wait and get a CAT scan in 6 months.
Give me some medicine if you can.
There is none. Remember I told you, there's no chemo, there's nothing in this world that can treat this.
Oh, yeah?
Right.
Oh, I'm afraid. Maybe I can wait for a while.
Well, okay, the liver is triangular shape, okay? If you draw an imaginary line, 45-degree angle, this is the right, and this is the left. The left has a natural indentation, so there's two lefts. There's this left and this left. The right liver is 60%. The left liver makes up 40%. The good news is, even though it's big, It's not in the middle. If it's in the middle of the liver, I cannot cut it out. Your liver mass is big. It's only involving the outer half of the left liver. So if I do cut out, I will be cutting half of your left liver. So you're not going to be losing a lot. You're going to be losing half of the 40%. So 20% of your normal liver will be cut out.
Did you think he can still handle that surgery on his
What
age?
I mean is that
He's only
how long it
74.
will take for me to...
Oh, I think so. Yeah, I think that you'll stay in the hospital for 5 to 7 days, and then at home recovery for 2 months.
Mm-hmm. No, what I mean is that you think I can handle that in my age?
How big's the
How about the operation? How big is it?
how big is gonna open it?
How big is the cancer?
No, how big, if
the
you're gonna...
opening.
Oh, I show you. Pretty big. Here, stand up.
Oh.
I can draw the incision.
Yeah, that.
Okay, here's the middle, right?
Oh, big.
Right, that's,
Okay.
over here.
Oh.
And then most of the time is this. The right side is longer than the left. Left goes halfway, the right goes all the way. Sometimes I do have to make a smaller, an additional cut up here, just to get up higher. But usually it's half of the left belly and the full right belly. Because the liver is...
Yeah, so
on the
you
right
have to
side.
take out all the liver, bring out the liver.
I only take out 20% of your liver.
Yeah.
Because the left liver, if you can see the picture, is thinner than the right liver. The right liver is thick. The left liver is thinner.
Well, anyway, I don't feel anything, so...
You still wanna wait a couple of months. You need to think
If I
about
feel
it.
something, that's the time that I call back. Can I do
Okay.
that? No?
Then if you don't want surgery, then let's just get at least a CAT scan in 3 months.
Yeah, that's
Yeah, please.
Your CAT scan was when? It was April?
Yeah.
Okay, so follow up CT in July.
Yeah.
Okay, can you call me middle of, oh no, June, I'm gone. Okay, call me first week of June, and then I can order. It's too early for me to order the CAT scan now. If you call me the first week of June, get my business card, leave a message with my nurse, and then she'll tell me. Remind me to order the CAT scan. So if I order in June, then you'll get it in July.
Okay.
And then you'll 3 months. And then that will tell us, is it growing, or is it the same size?
That's what I want.
Okay.
That's what I want.
Okay, all right. So call me then in June.
Okay.
Okay?
Well, thank you very much.
He's afraid right now.
He's afraid?
He
I don't
cannot
get scared.
He cannot decide it. He might be.
I know, but if you want a second opinion, you can ask. You can see other surgeons. I'm only
No,
recommending.
I trust you, Doc. I
We
trust
tried
you.
to cut.
No.
We just.
No, I
He just
trust you,
scared the
Doc.
operation.
I trust
Okay,
you.
okay,
No,
all right.
don't worry about that. I trust you.
Okay, because also, if we do wait, keep in mind, if it grows, not only can it grow to the diaphragm and the stomach and pancreas, it can also grow this way. Diaphragm is above. If it grows this way into this part of the left liver, then I have to cut the entire left liver, and then you lose 40% of your liver. You see? That's why we like to do the surgery before it gets too big. The bigger it is, the bigger the surgery is. And removing the entire left liver, that's risky. And I do have to admit, there is risk involved removing the entire left liver. But removing the outer half of the left liver, that risk is small. That's why I think you can handle it.
How about in my physical condition? Will it affect my physical condition?
See, that's why I would be honest with you. For example, if this tumor was on the right liver and I have to remove the entire right liver, given your age, 74, I would still offer you the operation, but I wouldn't be pushing for it. I wouldn't say, you know, I wouldn't be too excited about the surgery
Mm.
because of the risk. Removing the entire left liver, again, I wouldn't be too excited or strongly push for it.
Mm.
That's why I think that if we're only removing the half of the left liver that's safe, that's why I feel strongly that we should do it now when we can. Because I hate to see it in July or August to say, oh, well, now I have to take up the, bigger. So that's why.
Okay. Thank you, doctor.
Okay,
Thank you
thank
very
Okay.
much.
All right, give my business card, just call me.
Okay, in case that can my sister call you
Yeah,
about
call,
this one?
yeah, we can
Yeah,
talk, yeah, you change your mind.
Okay.
It's better to face to face, just make
Yeah.
an appointment, you all come in and talk to me.
Yeah, yeah.
Okay, thank you,
Probably
doctor.
one of my sister will call you and
Okay.
Thank
you
you, doctor.
can explain it to them.
Thank you.
Okay.
Okay, thank you very much, doc.
All right, you're welcome. All right.
When am I going to get your card?
Oh, the nurse's station. They'll give you my card.
Okay, thank you very much.
All right, you're welcome.